Hi everyone. This audio recording it's for all the students, those who are approaching your exam tomorrow. So some small tips you can keep it in your mind just before preparing your exam. So first I will tell you regarding the writing task. In case if you are getting the case note in that they mention that you are the community nurse, take care. Assume you are the one doing the home visit and see the task. Start present paragraph, that means a present medical paragraph, with the date when the first symptoms for the current condition has started. Please don't skip that incident. Then gradually you can make the story. After hospitalization, your home visit will start. Like that, if they have given the hint, that means you have to mention the surgery, what all the things has happened before your home visit. Most of the students they will start with today. Today, patient presented with these things. Then again, in the next paragraph, you will write about the past. So there will not be any continuation of the sequences, and you cannot conclude why you are requesting them care from or the management from the reader. So always it's better you can start with the first things when the problem, the current problem it has started. You can start with initially the patient, maybe this one was during your previous home visit, or maybe it's home hospitalization, or it's like a community center visit, whatever the thing, what all the things it's happened before your home visit. If it is related to your current problem, just start from there. You can start with initially, okay, and gradually you can make the story after the starting problem. Then during your home visit, what all things you have seen you can mention. Example, like he has been initiated with the home care under our service. That means until then it's past. It's already happened somewhere else. From there, you are starting your service. Then you can write in the next paragraph, you can write about your home visit incidents. And don't forget to conclude the present paragraph with the reason why you are referring. Like, however, an expert service from your facility is essential. So it is like easy for the reader to understand why you are writing the letter to the reader. And in case of noun case, always in the introduction paragraph, just you have to start with, I am writing to update you the current health status of Mr. or Miss or Mrs. like that. And at the end of the introduction, you have to write that he is or she is said to be transferred back into your care today or tomorrow, or what are the specified date back that should be there. And in a noun case, don't write the social paragraph. No need to mention anything regarding the past. Sometimes you will get confusion if it is non case, but you have to write about the past medical condition, like the patient is Alzheimer's, patient has Alzheimer's already, he is on medication or treatment, and the current problem also related to Alzheimer's. So how you will write, you can just write that as you aware, or you can write that since he has had Alzheimer's since 2016 and on medication. That means you are just reminding the reader that if it is a noun case, you can start with like that, since, or as you aware, he has had, like that. It's not a problem, you can start with the since, or as you're aware, because sometime in some writing tasks you could not exclude the past medical history if it is relevant to the current health problem. So just you keep it in mind. Just read the first sentence, that is important for you, because that is the first sentence is giving you the hint that what is your position, and from where you're working, and what is your role of the patient, for the patient. So from there you can start writing the letters, and always find out whether it is a noun case or unknown case. Then you can start reading everything. Just underline the important things. That important things are relevant data. Don't skip in your letter. Sometimes students will underline everything correctly, but they will skip to write in the letter. So don't skip anything. All underlined, I mean the parts are, you are thinking that it seems to be relevant, so it should be in your letter. And of course, in the recommendation paragraph, sometimes the recommendation will be in your nursing care, nursing progress, writing task, or in the discharge plan, or simply in the plan. Wherever they have written, it's like a recommendation. That thing, just you put the tick mark then you can prioritize 1 2 3 4 like that. Then you can make combination. If there are more than 5 recommendations, you can combine together. If it is more or less similar, you can write it in one simple sentences. Maximum three sentences can be together. You can make a complex sentences if you are using as well as or and when you are prioritizing, just remember the dressing or something, if it is there, should be the first, medication should be the second, third one should be the monitoring, fourth one should be the diet, and fifth one should be the physical activity or exercises, sixth one should be the advices or restrictions, anything, and the last one should be the follow up. So this is the sequence of your recommendation paragraph. Sometimes you can make some adjustments. You can make together some 2 or 3 recommendations together, then it's okay, fine, no problem. But overall there should be the sequence. And something, if it is started already and which need to be continued, means you can mention it in the present medical paragraph, like he has been, with the use of has been. He has been commenced on physiotherapy, which need to be continued. So it's already started and now it's continuing, and future also should be continued. So no need to write it again in the recommendation paragraph. Sometimes she has been commenced on antibiotic therapy, which need to be continued. That's enough. No need to write it again in the recommendation paragraph. I mean, sometime in the discharge plan, if the doctor, the treating doctor, will write the discharge plan for the patient, it is complete care, including the community nurses, social worker, or the doctor, or the GP, or the any therapist. But you should not think that all this recommendation is for your reader. You have to see the writing task to whom you are writing. Assume the scope of service. Example, if you're writing for the social worker, you should not write regarding the medication or anything else, because it's not scope of service for them. According to the reader, take care everything. The relevant data should be according to the scope of service. So especially in the recommendation paragraph, you have to choose the requirement, I mean the recommendations, according to the reader. Then you can prioritize, then you can write it in the letter. Always remember, in your answer sheet at the last page, it's an empty page, you can write whatever. If you can just write something, if you want to remember, if you want to make a story, how to just see the spellings or anything, if you want to make correction, you can just write it there. It will not be evaluated for your exam. It is for your rough paper, rough usage, so you can make utilize. And always when you are writing, make the alignment of your handwriting, I mean the letters, in the side. And don't forget to update, I mean don't apply your updates like commas before I mean your connectives, like before, for which you have to keep comma and which doesn't need any commas. In between your medications, you have to keep the semicolon, and after yours faithfully, no need comma. After returners, no need the full stop. And the age, the date format, so everything, the updated version, keep it in your mind throughout your letter. And after every paragraph, do the proofreading, or else you will miss many things at the end. If you are going for proofreading, you will find out some mistakes and you have to raise, you have to go back, you will not get time, you will be in panic, and many things will happen. So always, after each paragraph, read it again. If there is any mistake, raise and correct it then and there. And at the last, when you finish the letter, then again you can go for the complete proofreading from the starting until the end. Then your time will finish, of course, within that time, of course, you will finish your 40 minutes. Then for the speaking, when you will get the writing task, I mean the speaking card, just you see that whether it is a known scenario or unknown scenario. If it is it's like known scenario, just ask your interlocutor how you can how you can address them, and write the name on in your paper. What are the things you want to write, you can utilize in the paper. And if it is for like a second degree talk, if you are talking to the mother or father or relative, you can just ask the patient's name if it is relevant, or else it's okay, fine. And always throughout the role play, maintain the politeness and don't use like should, shall, then should not, don't. These commanding words should not be there. Instead, you can use please. It is essential for you to. It is vital for you to. It is important for her to. So these things and all you can use maximum. and you need to you have to it's these things and all, it's acceptable, but just you try to avoid these phrases. And in speaking, when you are doing speaking, another one more thing, just the time management. So just try to speak loudly. Maybe in some countries there will be the glasses, and you will have the barrier in between with your interlocutor, so you can have the permission to remove your mask, so you can remove the mask and you can talk loudly, so that you can make fast you are talking. If you are louder, you can fast the speaking, so that within time you can finish it off. And don't think that you will get enough time, they will give you some more time. So nothing, if within 5 minutes you have to finish all the tasks, and the first task, of course, it will be small, maybe the community health clinic or home visit or something, you will get adequate time. But second task will be big enough, you will not get time. In each task there will be subtasks, so you can underline the important phrases so that you can remember. And always after finishing the task, just put the tick mark, because in one task there will be subtask, three or two or three subtasks will be there. Sometimes the interlocutor will twist you, they will not ask you in the question in order way. So just put the tick mark so that you will come to know that which one you left over, then at the last you can ask them again. Don't give more irrelevant explanations. What are things is given in the writing, I mean the speaking task, you can just tell them this is the explanation. Don't over explain, so that you will not get time at the last. And the end, when you finish all your tasks, if still they didn't tell you the stop speaking, you can just sum up, it's okay, fine, no problem, according to the scenario you can do that. So always see the community, I mean the settings, community area or the home visit or the hospital or emergency department. Next, the sentence, what is that paragraph is given, read clearly. Come to know, you have to come to know whether it is non-scenario or unknown scenario. If it is non-scenario example, you are already familiar with the patient, just you can start with the name, just you can ask the name to the interlocutor. Example, if it's Maria, well Maria, thank you for allowing me to examine your affected part. Then you can start with the conversation, the first task. So because if it is non-scenario, if you are going to self-introduction and getting the introduction from the patient, you will lose 1 minute. So within that 1 minute you can complete your first task. So keep it in your mind, all these important points. Don't be panic, just to be relaxed. Of course you will become panic at that time, but no need to become tensed much, because it's like evaluation only. You can just be relaxed, don't be slow, very slow, and don't be very fast. Just you can maintain the speed. And if there is any hummings, it's okay, fine, normal, it's like a normal way only. But you can just try to finish your complete task. So how much you are doing, everything should be within a polite manner. So if something, if there is mistake, but if you present it as like a polite manner, of course you will get base score. So keep everything in your mind. Best of luck, you can do your best. Okay.